Hi everyone, I'm Barbara and welcome to Age Better. Have you noticed how testosterone for women seems to be everywhere lately, from TikTok videos to Instagram posts? Women's health experts are really buzzing about it. And if you're like me, you're probably wondering what's behind all this sudden attention on testosterone. Is it just another trending topic? Or could testosterone actually be a missing piece in women's health that we really need to understand better? I don't know. Let's find out. That's why I've invited one of my most trusted go-to experts, Dr. Margaret Nachtigall, a reproductive endocrinologist at NYU Langone Health, back to Age Better to talk about this. In this episode, she'll help us understand exactly why testosterone matters for women, what it can and can't do for your body, and most importantly, how to know if it might be right for you. Whether you're dealing with fatigue, low libido, brain fog, or just curious about optimizing your hormonal health, you'll want to stay tuned. And remember, your voice matters. After you listen to this episode, I'd love to hear your questions and suggestions for future topics. So send them to me at agebetterpodcast@gmail.com or reach out on social media. Alrighty, thanks for listening and get ready to age better. Hello, Dr. Margaret, and welcome back to Age Better.
Hi, Barbara. Great to be here.
So today we're talking about testosterone. You know, it's a really hot topic on social media. I get a lot of questions about it, and apparently so do you in your office. So let's get right to it. The basics. What role does testosterone naturally play in women's bodies, and why is it so important to our overall health?
Great question. So testosterone is one of the hormones that women produce. And it is made in two places in the body. It's made in the adrenal glands, which are these two little glands that sit on top of your kidneys. And the adrenal glands are responsible for all your stress hormones, the fight or flight that you hear about. In addition, they make androgens, male hormone. The other place that women make androgens are the ovaries. And women continue to make a small amount of androgen even after menopause. But certainly during the years that the ovaries are active, they're making estrogen, they're making progesterone, and they're also making testosterone. And testosterone plays a big role in our bodies. It's responsible for a lot of things. Some of the things that we know about are libido, muscle mass, general health and sense of well-being, and they are also responsible for hair growth, for hair loss on your head. They're what causes acne and all sorts of other things that we use testosterone for.
Mm-hmm. And so a lot of women are surprised to learn that their levels kind of decrease as they get older and then go through menopause. So why is this happening?
Well, there are a number of reasons of why this happens. One of the reasons that it happens is because the ovary is really not working as it was before menopause. And so although both ovaries are producing a small amount of testosterone, it's not nearly to the degree that they were producing it before menopause. And you know, just like so many other things in the human body, this is so variable from person to person. And to just make it a little bit more complicated, testosterone circulates in our body bound to something called sex hormone binding globulin, which is something that holds it as it travels through our bloodstream. The biologically active part of testosterone, or the free testosterone, is the amount that's not bound to that sex hormone binding globulin. So just to make things a little bit harder is that your total amount of testosterone might be different from the amount of free testosterone, depending on how much of this sex hormone binding globulin your body has. And that varies in different situations. People that have more testosterone tend to have lower sex hormone binding globulin, and more estrogen increases that. So it's a complicated system that we have.
And so if someone wants to know what their levels are, do they normally come to you and say, hey, I don't feel any differently. There are no real symptoms that I could really pinpoint, but let's get tested anyway. Or do patients normally come in and say, you know, I'm just not feeling like me. I don't really have much interest in sex like I used to. What are some of the symptoms that you hear? And how can women actually be tested?
Those are a number of questions. So first of all, a person can get tested if you want to get tested for your testosterone levels, but usually you will get both a free testosterone as well as a total testosterone level. And usually the reasons that people come to me to test their testosterone levels are because they have negative symptoms associated with elevated testosterone, such as people who have hair growth that's unwanted in parts of their body, or hair loss on their head, or acne. These are all side effects of either too much testosterone or someone who's taking testosterone and the level is too high. Mm-hmm. So those are usually the reason that I see people who are actually requesting to have their levels tested. But what you're talking about is postmenopausally, is someone is coming in because they have a tremendous lack of libido, or they're just feeling like they're on perhaps estrogen, but they still don't have the energy that they're looking for. And then sometimes we do measure testosterone levels. There's not an exact connection between your level and necessarily how you're feeling, again, because there are so many factors that are involved in receptors, and different people have different levels. And so it is a little bit difficult to extrapolate just from a blood test. But certainly if you have a really low level, that is significant, or a really high level.
Mm-hmm. There's been a really big buzz around testosterone lately. Like I would say in the last year, there are quite a few doctors and menopause specialists who are on social media talking about testosterone and really encouraging women to talk more openly about it and to talk with their doctors about it as well. So are you hearing more of a buzz from your own patients about testosterone? And why do you think there's an increase in interest in testosterone?
That's a great question. I don't know exactly what is causing the increase in testosterone, but one thing I can tell you about testosterone supplements for postmenopausal women is that it right now is not FDA approved. There is one type, which is an estrogen plus testosterone that's given by mouth, that is FDA approved. But other than that, there's no testosterone supplement, no cream, no gel, no patch that is FDA approved for use in women. There are formulas that are made for men and FDA approved for men that we can use in much smaller quantities, but there's nothing FDA approved for women. And so what's accounting for this increase? Well, testosterone supplements do have some effects that are favorable, such as an increase in libido. Some people do find an increase in energy, and some people also will attribute it to an increase in muscle mass, which makes sense. Mm-hmm. So for those reasons, it really can be beneficial. And for the person that has no testosterone or very, very low levels in a postmenopausal state, then it's certainly understandable why they would want to have a small amount of testosterone, which it makes sense. It's reasonable, even though it's not FDA approved. And whenever anyone does get testosterone, it's important to be monitored, to measure how much testosterone you're getting so that you can recognize if the level is getting too high, because those side effects of a high testosterone may come into being, such as hair growth, acne, or hair loss on the head. Mm-hmm. It can also increase cholesterol levels, lipid levels.
Oh, interesting.
So you also want to keep that level. If you're going to supplement, you just want to supplement to what we call a physiologic level, meaning a normal level, not to supplement someone to have a high level. And I think that's important.
So what are some of the different ways that women can take testosterone? And it would be prescribed, but you also mentioned over the counter. So there are different options.
So over the counter, there's no testosterone that you can take, but you can take supplements that have similar effects, such as DHEA. There's a product called Restella made by Bonafide that is a supplement that acts like a testosterone. But in order to get testosterone itself, you need to have a prescription. And then that prescription can either be for a formula that is made for men, such as Androgel or Testum, or it can be made in a compounding pharmacy where you put in the dose, the doctor would put in the dose that is recommended, and then the individual would get that and then apply a very, very small amount. Now, testosterone is not well absorbed by mouth. And so the vehicles are either a gel or a cream that is usually applied either behind the knee or on your forearm or on your inner thigh. And so it's really transdermal that it's best to be absorbed or under the tongue. So the way people get now, interestingly, in order to prescribe testosterone, you need a triplicate prescription. In other words, one, not just a regular one at the pharmacy, but even a specialized one in order to receive it. So it adds an extra element of difficulty for the person who's prescribing the medication.
Yeah, that's interesting. I think a lot of women, and I've seen this on social media, and I've also gotten a few emails about this, that they're confused, and some are even angry that it's not FDA approved, that it is FDA approved for men,
right?
But it isn't FDA approved for women.
Right.
Always such a lag time. I mean, I guess the assumption is, and please tell me if I'm wrong, is that at some point it will be FDA approved, hopefully.
Well, I think we need more randomized clinical controlled studies looking at the efficacy and monitoring the side effects and any of the potential dangers before it will get FDA approved. I think we do need more studies on this, but we did a study probably 25 years ago where we used a testosterone patch for patients who were already on estrogen, and we were looking at general sense of well-being as well as libido, and patients at the end of a year or 2 years were given the option of continuing versus not continuing. And those that were on almost unanimously opted to continue, meaning that they certainly liked being on it. So I think that, to me, it definitely can be appreciated by some. There is patients who have had their ovaries removed, either because of ovarian tumors or because they have a genetic predisposition to ovarian cancer, or for whatever reason. People who don't have ovaries any longer are certainly going to have very low levels of testosterone. And that really may be a very particular group that really benefits from having some testosterone given postmenopausally or after the ovaries are removed.
You did mention that that group that was studied, they were on HT, hormone therapy.
Yes.
And is that a prerequisite? No, you don't like it. Does it work better somehow with HT?
It's not always, but I think some of those symptoms that you asked about in the very beginning, such as a lack of libido or lack of energy, some of those are remedied by being on estrogen, which is FDA approved.
Right.
Obviously, it's not right for every single person, but certainly being on estrogen may help enough. And in other people, they may feel that they still need a tiny, tiny bit of testosterone to add to that. Again, it's not FDA approved, but some people will opt to be on. And I think one of the things to realize is, since it's not FDA approved and it sits in so many situations, we're relying on a compounding pharmacy to make up the formula. There's a lot of variation that can occur there. It's hard to get the exact dose.
Right.
So it's a challenge, I would say.
Yeah, it sounds like it is. And I know that there are women who are curious to know, what can I expect? Let's say people listening do get tested. Right. Maybe it's a little low. They decide to try it. What is the expectation for how they will feel?
Well, some people feel, I would use the word super fantastic. I have to say, there are some people whose testosterone levels are very low, and it's been a struggle. Never really knew that that was the problem. And then they go on testosterone and really appreciate it. They appreciate it for their general sense of well-being, for their energy, for libido. Some people notice fewer headaches when they're on it. It can be a great supplement, but others hate it. Some people have agitation. They feel that same feeling that you had when you were premenstrual. Some
Yeah.
people get
Yep.
that feeling.
Yep.
Some people feel angry. Some people have too much libido. One of my patients told me that she had, and I'm going to quote, sex on the brain all the time. And for some people, they might like that, but she did not like that. And also, if the level is a little too high, you can have those unwanted side effects that we already talked about: hair loss on the head, hair growth on the body, and acne, or one of the others. So it's very individual. I think that's the answer. I could have given you a really quick answer that would have just been, it's very variable. Some people like it, some people don't, and some people are kind of indifferent.
Yeah. And like you always say, it's so individualized. I mean, everyone will respond to it differently.
Yes.
Right?
And again, it really matters also your environment. In other words, what is your sex hormone binding globulin? And one of the advantages being on estrogen is that raises the sex hormone binding globulin, which means there's going to be less free testosterone. So that means that there's probably going to be a little bit less of the hair growth or the acne or the hair loss. And then there are other factors of testosterone supplements that we're not always so aware of, such as the lipid effect, the negative effect on the lipid. So we have to think about that. And, you know, when you look at cardiovascular disease, does it potentially increase in that? So far, the studies don't look as though that's the case, but that is something to look at. In addition, testosterone does get converted into estrogen in the body. It's called aromatization. And actually, the more adipose tissue or fat that an individual has, the more aromatase activity an individual has.
And that's fat around the belly area.
All fat, not just around the belly. That's visceral fat, but all fat has the ability. It actually is an endocrine organ. It can actually aromatize. It converts testosterone into a type of estrogen. So taking testosterone, you're actually converting it in the body into estrogen, which is just interesting.
Oh,
in
really
certain
interesting.
people, not everybody, but in some people.
So I have a question for you, Dr. Margaret. Do you think that every woman should just come in as a matter of course and get tested for testosterone or not?
I don't. No.
Okay.
I really don't. I think that most people who have not had their ovaries taken out have levels that remain in the normal range, or normal enough. Remember, the adrenal glands are also making testosterone. So I don't think it's something that everybody has to get.
Okay. So testing really is based on symptom, right?
Well, and as you said, desire. Some people want to be tested.
Right.
But in menopause, and sometimes when I am evaluating a new patient in menopause, I will get testosterone levels to see where they are. Because if we are contemplating starting any hormone therapy, we really want to know where they are as baseline before initiating treatment.
So we're seeing a lot more research coming down the pike, luckily, and we certainly hope that continues. More research behind women's health and wellness. We hope that continues. But do you see anything else coming down the pike that we should be aware of, be looking for, that you're excited about?
There's a lot of research, fortunately, in the field of menopause. And I think that the area of testosterone is really interesting and important. So yes, I do think that there will be more and more research on this area in terms of its benefits for hypoactive sexual desire, in terms of its ability to improve libido, in terms of its ability to increase energy, in terms of its effect on the bones, and will it help with bone density? We still need more research in this area. So yes, I think there's more research to be had and more research being done. And also, what is the delivery system? Yeah. Is it a patch? Is it a cream? Is it a gel? What is the best way? Is it a lozenger that you put underneath your tongue? What is the best vehicle if one is going to take testosterone? And then just your other question, should testosterone be used with estrogen? And is there a role for it without it? And then again, the areas that are not testosterone, but other androgens, such as DHEA and other hormones that you can give to give some increase in those same areas, such as libido and energy.
Mm-hmm. Mm-hmm. Okay, well, we covered a lot of ground with testosterone and what it does, how it can make you feel better in many cases, not all, and who should be tested and who necessarily do not have to be tested. So thank you for all of that. Before we wind this down, can you maybe share your top 3 takeaways?
Absolutely. I think the big 3 takeaways that I would say are sort of just what you just said, which is 1, FDA has not approved testosterone for administration in postmenopausal women. So that's number 1. It is not FDA approved. So there's no formula out there for postmenopausal women for any reason, except for one, which is an oral one sold under a brand name of Estratest, which is an oral estrogen and a oral testosterone. But other than that, there's no FDA approved testosterone. 2, if you have symptoms of low libido, low energy, it may be not related to testosterone. So it could be just I shouldn't say just because that's the wrong word to use. It could be menopause and it could be a decline in your estrogen level. So I think back to my summary is 1, FDA has not approved testosterone supplementation for women. 2, testosterone does not work well orally. And so if you are going to consider testosterone treatment, it would be either a gel or a patch or some transdermal delivery system. And you either have to use a formula that is made at a much higher amount that for men, where you'd have to use 1/10 of what they're using.
Right.
Or use a compounding pharmacy, which has its own regulations. And in some individuals, it may have advantages, such as muscle mass improvement or in improvement in libido and energy. And in other people, it can have some negative effects, such as anger, agitation, hair growth on your body, hair loss on your head, and acne.
And also an increase in your cholesterol.
And lipid increase. Yep. So I think the bottom line is we need more studies to be able to evaluate whether testosterone supplements are safe and effective for postmenopausal women. I think that's where we are right now.
Thank you so much for that.
You're so welcome.
How busy you are.
Thank you.
I really appreciate your taking the time out today to talk us through it.
Always good to be here. Thank you.
We'll
Thanks
see
for
you
having
soon.
me. Okay, sounds great. Have a great night. Bye-bye.
Thank you. Bye. Thanks for tuning in, everyone. If you enjoyed this episode of Age Better Podcast, please do a few things. First, share it with all your friends and family. Then, subscribe to Age Better wherever you listen to podcasts, including YouTube, so you never miss a single episode. Finally, if you have ideas for topics you want me to cover in a future episode of Age Better, send an email to agebetterpodcast@gmail.com or reach out to me on social media. Until next time, remember this: we can't control getting older, but we can control how we do it. Talk to you soon. Age Better Podcast is a proud member of the Sound Advice Network. Sound Advice, women's voices amplified.